Hello, my name is Angie Spence, and I am the Director of the Regional Alliance for Healthy Schools. Today we'll have an opportunity to orientate you to the RISE program, and we'll do a walkthrough of several of our health centers. You'll also have an opportunity to hear from some of the youth, the staff, and community partners.
Hi, my name is Steve Park. I am a pediatrician by training, and I serve as co-medical director for RAHS, the Regional Alliance for Healthy Schools. When I think about school-based health, I think about the opportunity to find kids where they're at. One of the things that we know about social determinants of health is that there are a number of things that can get in the way of children being connected to regular primary care services, let alone complicated services. And by finding kids at one of the last places that they're at, an organized community at their school, is one of the great benefits of school-based health, that we can actually reach those kids that aren't getting services elsewhere.
I think what's different between school-based health and different health environments is definitely the environment itself, right? We're here, we're local, we're in a familiar place, and we are a friendly face that they know and they see us from day in, day out.
We're blessed that we have awesome staffing. Our director makes sure that we have absolutely everything we need, from exceptional nurse practitioners, physicians, master's level social workers. We've integrated registered dietitians into our health center. In addition to doing some really innovative things like having a mobile unit for vision services and dental services, to partnering with the community for emergency food boxes for food insecurities. I think it's knowing your community, knowing the needs of the community, not only of our students and our families, and being able to address those unmet health needs. School-based health centers really help the community by meeting the community where they're at. Students spend most of their time in school within a community where parents trust, where they have relationships, where they trust, and schools are always accessible to youth. So it's really making sure, one, that we have extraordinary and exceptional services that the students need, but also making sure that they're convenient and they have access, that all families have access, and a place that's not only convenient, but also that they trust. And we need to keep these students learning, we need to keep them healthy, and we need to keep them in school.
So I think that it's important for several reasons. One, it's important for families to be able to have access. So services where there may be an out-of-pocket expense for services, there may be a co-payment that's required for services. Our services help eliminate that barrier and essentially access. So if the student goes to school in the building, then essentially they're able to come right down and access our services. They just need a consent to be seen.
So with that, we want to make sure that anything that they're due for, they're getting. That includes immunizations, making sure they're fully immunized with HPV and flu, and everything that we know is going to keep a child or adolescent healthy. What is it if they're overweight or obese? How do we provide that guidance? We have registered dietitians on staff, which is excellent. If they're hungry or they're underweight, we have programs for food insecurity. If they have anxiety or depression or school avoidance, we have that master's level social worker to help teach them skills, right, and coping skills to make sure that they're successful. And then once we are able to get them insurance, and they can certainly come to us insured, but we're able to partner with their other care providers, right? The students in YAC, some of them have primary care providers, but how can we work together to keep that student in school and being successful?
There's an opportunity for the schools to partner with RISE around wellness and health initiatives, but also what does that mean for the community at large when they look at having this great opportunity right there in their community to have all of the primary care setting services right here within the child's school. And that means they don't have to miss work, and the student can still receive the services that they need. So on a macro scale, we joined several other school-based health centers in the state of Michigan providing these same services. So macro, when you look at Michigan, there's over 100 school-based health centers throughout Michigan, and we're just one of the many providing similar services.